Good evening, and welcome to what's scheduled to be the last community conversation, at least for now. My name is Brian Wheeler. I'm from Mono County Public Health. I'm once again joined by local and county officials to discuss COVID and our current situation. But before we get into presentations, I just want to remind everyone of our website, which is monohealth.com/coronavirus. You can get all the most up-to-date information on that site. And I also have an announcement that the 211 nurse hotline is going to now be Monday through Friday, 8 to 5. Instead of 7 days a week, we're moving back to 5. Stu, you want to give your presentation?
Great, thank you, Brian. Thanks for the panelists for joining us. Thanks for everybody for listening in and watching. Been a busy couple of weeks, so let's just get right to it. But again, my name is Stuart Brown. I've been honoured to serve as the Lead Public Information Officer in the Unified Command Emergency Operations Centre with an amazing team of upwards of 15 public information officers, IT specialists, marketing experts delivering accurate, timely, and transparent information throughout the county. So with that, we shall begin. A few updates here. Just want to get to, again, as Brian mentioned, last scheduled communication. Thank you for joining us throughout this endeavour. We'll give you updates on how we're doing on testing, our path forward. We have some community updates, Parks and Rec, Lakes Basin, Reds Meadow, Indian National Forest updates, Mammoth Resorts update, and then the Chief's going to wrap it up with a brief update on the Emergency Operations Centre. We're all in this together. Just want to make sure that everybody is still wearing their face covers in public. Want you to be smart, do your part, and wear a mask is the new state campaign. And on June 18th, the state also mandated the use of face coverings in public. So we'll talk about that a little bit more coming up. Again, as Brian mentioned, do call 211 if you're sick. That is available Monday through Friday, 8 a.m. to 5 p.m. And again, we have a little bit more information on testing, but several options for asymptomatic adults throughout Mono County. Weekly metrics, here we go. This is for the last 14 days since June 10th. We've tested over 335 people. 3 have been positive. And that is a positivity rate of 0.9%. If you're looking for this information, it's on the portal that we mentioned on the website, and just look for the case stats graphic up there in the top right-hand screen, and all this information is updated daily. If you want to get into the county-wide metrics, this is as of today. We've tested over 1,300 people, over 1,200 negative, 53 pending, up to 40 positive cases, and you can kind of see on that graphic where those cases are located there throughout the county. And our positivity rate is 3%, and I believe the state's tracking at about 5.6% at this time. Again, this information is all on the portal. Just look for the case stats graphic. As Brian mentioned, Brian and Jody lead up a fabulous pop-up testing clinic program. This is free throughout the county. It's now offered 4 days a week. And they've conducted over 400 tests and have 1,000 test capacity every week. So no excuses. Do it for yourself, do it for your family, do it for your community. These are the upcoming dates you can see here, anywhere from Monday, June 29th, Bridgeport, Lee Vining, back in Mammoth on July 1st, July 2nd, Mammoth Lakes Latin Market again. This information is on our main portal, and just look for that health tab. You also can get tested through Project Baseline by Verily. This is every Tuesday in Mammoth and then throughout the county. Again, no cost for individuals, regardless of insurance status. You do need to register before you get tested, and a Google account is also required. And you can see you just must be 18, live in Mono County, and sign the applicable forms. Again, all this information and more is available on the Health tab. So do look for that information on the portal. This is just an interesting statistic of all the testing locations and the percentage of those destinations that have been performing testing. Again, this is on the case stats portal. You can see Mammoth Hospital almost at 2/3, public health. They're getting there at 31% and climbing. You can see Northern Inyo, Verily 7, and you can see the other stats as well. So a lot of testing going on throughout the county. June 18th, state released guidance mandating the use of cloth face coverings by the general public when outside the home. There are some exceptions, so look for that information. And this is similar to the public health officer issued a similar order issued on May 1st. And Sheriff Braun is unable to be here this evening, but wanted to relay this information and this statement to the public if you are listening and watching tonight. So again, they're going to seek to educate and gain voluntary compliance. Those who are aggressively uncooperative will be charged with the appropriate criminal violation. Again, this information can be found on the portal under the Directives tab. This is a great fun video that the state recently put out as well, all the 5 living California's governors. And again, that is the state website on the bottom right-hand corner of your screen there, covid19.ca.gov. Stay safe to stay open is the new campaign that we're pushing throughout the county. It speaks to both sides of the economic relationship. So in order for our economy to reactivate and recover, we must all work together through safe practices and neighborly courtesies. Staying safe and protecting each other is something we can control. So we invite you to join us in this effort, showcase your safe practices and support our local businesses. This flyer is available throughout the county on our big notice boards. You'll see it on our social media posts. So please stay safe, and we can make sure that our community and local businesses stay open. Path forward, again, just a quick update here. Look for this graphic on the portal. We are still in expanded stage 2. So all the information and more can be found on that portal. These are the current business sectors permitted to open in Mono County with modifications. So again, this is the current list on the self-certification portal. So if your business is here, click on that little tab and self-certify. This is the information here if you need that information to self-certify your business. If you're eligible, you must self-certify to meet all the health and safety requirements. You'll receive a certificate that you can post prominently at your place of business. And again, business guidance, FAQs, self-certification, all under the business's resource tab on that website there. So please look for that. Please self-certify your business so we can all stay safe to stay open. A quick update on lodging throughout the town of Mammoth Lakes. As you know, we reported this 2 weeks ago. Unincorporated Mono County lodging properties opened on June 12th. But for the town of Mammoth Lakes, these are the additional modifications that were released on June 19th. And you can kind of see the outline here from hotels and condos open with a weekly 75% occupancy limit. Short-term rentals have the 24-hour vacancy. Following each occupancy, must follow the cleaning standards put in place by the state. If your property has a pool, this is a HOA, hotel, motel, campgrounds, RV parks, the pool may open, but hot tub saunas and steam rooms are still to remain closed. And again, campgrounds, RV parks are open with 75% capacity and 20 feet of separation between sites. Again, this information is on the business tab. Town recently allocated $300,000 to a business assistance program to help small businesses in Mammoth Lakes. Businesses must have at least 1 and up to 10 full-time equivalent employees or FTEs and less than $1 million in gross revenues. Businesses must also have a physical commercial storefront, and businesses must demonstrate that immediate assistance from other sources is inadequate. The initial grant application period will begin on June 27 and will close on July 10. This information will be posted online tomorrow, we believe. And again, that information will be available on the Town of Mammoth Lakes website, which you can see at the top right-hand corner of your screen. Parks and Recreation update. We are thrilled to announce that the Whitmore Pool will open on Monday, July 6th for lap swim only. No recreation swimming will be offered at this time due to the COVID restrictions and guidance from the state. Lap swim season passes and 5 swim passes available online, and then youth summer camps We'll also kick off on July 13th through August 14th, 5 weeks of camps. Registration begins on Monday, June 29. So again, look for that information on the Parks and Recreation tab of the Town of Mammoth Lake's website. Hot news for the week. Everybody wants to know when the Lakes Basin Road opened. It opened today, opened this morning. But please be advised that hazard tree work continues, so please be aware. These are the campgrounds scheduled to open on June 26, Twin, Lake Mary, Lake George, Pine, and Coldwater. You can see the current campgrounds open. Lakes Basin Trolley commences on Friday. Reds Meadow Road also opens on Friday. But shuttle service to Reds Meadow, Devil's Post Pile will not operate this year, and campgrounds are not open at this time. Yosemite National Park and Tioga Road is open. Travel through the park is permitted for permanent residents, but must be for non-recreation in nature. You're still required to have a reservation to enter Yosemite. Yachts is operating. You'll need to wear a mask, a face cover if you're on yachts. You will not need an advanced reservation if you're on yachts. And then there was some confusion about the campgrounds. Some campgrounds are open, but some remain closed due to lack of employees, scheduling, due to the current COVID restrictions, not due to transmission or any COVID cases in Yosemite. So just quickly, Mammoth Resorts update. Representatives weren't able to join us this evening, but I'm sure everybody knows Mammoth Bike Park, Scenic Gondola Rides, 1153 Cafe in the Yodeler will open tomorrow, Friday, June 26th. And on June 19th, short-term lodging opened, including Campo in the Village. This is the list of local information and resources. As the Chief mentioned and Brian mentioned, we're phasing out the kind of EOC number. So we want to make you aware and bring your attention to the town short-term rental hotline numbers, the town code enforcement numbers, and the Mono County COVID-19 violation email. That would be your primary source for information from the town or the county regarding TOT, code enforcement, and so forth. We still issue the daily brief. Again, that's on the homepage, Monday, Wednesday, and Friday. And again, we have very robust websites in both English and Spanish. And for any question you may have regarding COVID-19 throughout the county, please email us at covid19help@mono.ca.gov, and we typically get back to you within 24 hours. With that, I'd like to pass it over to the EOC Director, Chief Freevolt, for a brief Emergency Operations Center update. Chief.
Thank you, Stu. Work as always. Good evening, everybody. Thank you for joining us. We have intended to be, at this point, the last community conversation. Excuse me. We're presently in the process of transitioning from an EOC level activation of 2 to 3. Level 1 is the highest. We've been in that for a little over 2 months. And then about the last 3 weeks, we've been in level 2 activation. And now we're going to, the idea behind the 3 is that we're going to turn most of the functions we've been overseeing and managing back to town and the county. And most of the EOC personnel are actually town and county personnel, with very few exceptions. It's just a different way to organize the personnel to work more efficiently across all the layers of government. Really key things going forward are going to be the public health monitoring. You heard Stu talk about the testing that's available throughout the county. It seems like a long time ago, but when we were going through the stages with the state and we were requesting expanded stage 2 so we could start to open some businesses, some of the requirements there were to make sure that you were doing enough testing to have some public health radar, if you will, on what was going on with infections in various communities. We're at and exceeding that level of testing, and it's essential that we keep doing that going forward for some time. And so Brian is heading that up with the team. They're doing some great job, sweating like crazy in those colorful outfits they have as summertime rolls in, doing some great work there. That is going to be very vital, that we maintain the ability to understand what's going on with infection rates. You do more testing, you're going to find more positive cases. We understand that, but what we're looking for is the the proportional increase. And that's going to be key. The second thing is going to be visitor behavior. It seems like we hear about, which is good. People will tell us, hey, I was in this business and, I didn't see the right behavior, or I was in that business and maybe I didn't have everything quite right. By and large, as we've been going through the county, it's been phenomenal to see how well most of the businesses are doing. They really are doing pretty well. The challenge is with a lot of times the visitors or the people that come to town. You all have been amazing here locally with all you've had to put up with and sacrifice and help us, with meeting these public health mitigations so that we could get this thing under control and get back to normal. But the two things going forward that are going to be key is for public health to keep their radar out there with high volumes of testing and how the visitors behave when they get here. And quite honestly, the best way to do that is going to be through all of us. It's going to be how we conduct ourselves here. And, don't look for conflict, but, if someone is missing something, feel free to give them a polite reminder. Everybody wants to be here and wants it to be open. And the fastest way we'll lose that is if we have a high level of visitation where people just aren't following those basics of distance, wash, and cover. So those are going to be really essential. Please help us with those. And then while we're doing that, we'll maintain essential capacities in the EOC to support those operations on into the future for some time. As Stu mentioned, the EOC phone and email access is going to be rerouted back to the town and the county as appropriate. You'll probably, starting sometime tomorrow, if you were to call in, you'd probably hear some rerouting information. And then we're also doing that in the email space as well. Please stay informed on what's going on with the county COVID website. As Brian mentioned, we've all seen these thermometers out in front of a school when they're trying to do a fundraiser or those types of things. And we put the metrics up on the website, not just to keep people informed, but to really make sure we all understand what our situation is. And as we have a lot of people come in, the Road to Lakes Basin was packed this morning. I was in Vaughn's a few hours ago. It's pretty busy. And part of that is good, right? We're a tourist-based economy. Those are the things that we need to have this place be what it has become. But it's also a great way to be, spreading this thing if we're not careful. So please stay informed on what's going on at the website. Those numbers will be updated regularly. Stu and his crew do a great job with that. And just be situationally aware. I mean, it's a little bit like, we check the weather all the time. If you're going to go skiing, I check it for fire season and, check it like you would check the weather. Just pop in there, daily and just see what's going on. And then lastly, I want to thank all of you out there in our local community for the phenomenal work that you've done. It's been incredible. This hasn't been an enforcement game. This has been about influencing and about your willingness to do all these bizarre social behaviors for our own good for such a long time. And you've done amazing work. I also want to give a big thanks to my Board of Fire Commissioners. I will next week, if all goes well, start getting back to my day job Tuesdays and Thursdays. I think I'm gonna have to reintroduce myself to some of the staff there. And I want to thank them. I turned the fire district over to them sometime in mid-March and never looked back. Highly competent group. They've been handling everything that you can imagine, and they've done a great job. So just a thanks to my board and thanks to my fire staff, and look forward to getting back with them at least part-time here for the near future. But remember, we just can't quite get complacent yet. Still need to be vigilant. Distance, wash, cover. Please help us pattern the behavior for the visitors when they come here. Make it cool to be in Mammoth, make it cool to cover up. All right. Well, I think that's all I've got. Thank you, Stu.
Thank you, Stu. Thank you, Chief. It's been a pleasure working with both of you and everyone that's on the panel today. Before we go to questions, do any of the panelists have any opening remarks? All right. Lauren, what's our first question?
In light of the huge upticks in California numbers, it would be nice to have this meeting weekly, not discontinued. Will there be a meeting in the future, and how do you propose people stay informed?
Well, I mean, as the chief mentioned, tune into the website frequently to get the most up-to-date information. Chief, would you like to elaborate on that?
You're on mute.
Hi, Robin.
Well, you would think after all these meetings, I'd still obviously not built for Zoom. It's an excellent question. It's interesting. The EOC in some ways has been the bane of people's existence for a while, and then we started talking about demobilizing. It was like, hey, wait a minute, what are you doing? It is the people that you have at the EOC staff are the people that are running essential parts of government all the time. And we have rightfully all realigned ourselves to handle this crisis, but we really do have to balance it with other things that are going on and needing to refocus there. We do want to rely heavily on the website. We have, I say we, Stu, and the JIC have done an amazing job with IT to make that as informative as we can. But just a reminder, I mean, was it yesterday, I think? We had earthquake in Lone Pine with some rock slides. We had some waterborne emergencies. We had a structure fire in town. As we get more visitors, all layers of government are going to need to gear back up for their daily function. So I understand the question. It's, I guess it's a good sign that someone would want to tune back in regularly. It means we haven't quite scared you off yet. If things change substantially, I'm sure we'll spin these back up, and that'll come down to our unified commanders. But stay tuned on the website, and if we think we really need to get some other information out there and really reconnect, we'll do it. But I've got to turn these people back loose to their day jobs. There's a lot going on out there.
Can I add something? And I apologize for the puppy playing. Maybe you like puppy. Is that cool, Ryan?
Absolutely. Go ahead.
So we're having a meeting every other week that doesn't answer questions like typically get asked at this meeting, but that are about how are you doing? How's it going for you in terms of your emotional life, in terms of how you're just managing life during COVID. So we will have our next meeting on July 8th at 5:30. It's on Wednesdays at 5:30, and happily invite people there. Again, it's not the same as this. Hey, it's not the same quite as this meeting, but it is definitely set up for our community to keep us moving forward and keep us dealing with all of the feelings that we have about when people are or are not compliant, and just really basically all of what it feels like to be going through this. So we will invite you to that as well.
Thank you, Robin. Thank you, Chief. Lauren, do we have another question?
Why did you tell TOT license holders not to do any marketing telling people to come to Mammoth, but then I see Visit Mammoth running ads on Instagram encouraging visitors?
Dan, are you on and available to address that?
Actually, Brian, I can take it if you're okay.
Oh, sure, absolutely.
So we definitely wanted all of our TOT folks to have a bit of a slow start and not really push hard to get visitations, really limiting the people coming to town. As you know, that folks that are in town, there's quite a few people here, even with maybe a drawdown in the advertising component. The one thing that we tasked MLT with, or Visit Mammoth, if you will, was really to start a campaign of responsible tourism, so people would understand what the expectations are when they're going to arrive in town, and also what amenities are open or not available. So I know that recently the information shared by Visit Mammoth was really about when the Lakes Basin is going to be open, information about Red's Meadow, but really they're sort of tasked being our outward facing message board, if you will, to really talk about things in town and how they may be different than their previous experiences. So without strongly pushing for people to visit, at least not at this moment, it's really more what to expect when you visit and how to be a responsible tourist.
Thanks, Rob. Lauren, can we go to the next question?
It is getting very frustrating to see how many businesses in Mammoth are not enforcing wearing masks. What can be done to improve enforcement, and what is the actual fine?
Well, unfortunately, we don't have Sheriff Braun with us tonight, but Chief, are you able to address that question?
Yes, we saw that one out there in the queue. So there will be, essentially the approach is to try to do education and voluntary compliance. We've not had a really heavy-handed enforcement need. By and large, people have been really supportive. There's always what do they say? There's always one in the crowd, right? But for the most part, people have been pretty good on it. One of the challenges is we'll hear about these things, hours, days after they occur. There's no real way to go back and do that. And so, as I was saying in my earlier comments, this has to do really with how we visually cue for those around us. Again, like I say, don't go out looking for, trouble trying to get people to mask up. Shaming does not work very well. It may feel good, but it doesn't work very well. It's really just about trying to pattern the behavior ourselves first. But for those people that really, really go out of the way to get aggressive and be uncooperative, the fines can be up to $1,000. It can be up to 90 days in jail. And there can be other things that go along with that. Usually once people start arguing over something as frivolous as mask, they make other poor choices as well. And I'm sure local law enforcement will leave all options on the table. So that's the answer, but let's hope we don't have to go there, and let's try to influence. Rob, I saw your hand go up there.
Yeah, we also have these weekly meetings with businesses in town, and a couple of the business owners had some pretty good responses. And I think that as folks are coming into businesses and without a mask on, their procedures were essentially to provide them a mask and ask them to put it on. If they refuse to do that, ask them to leave, and if they refuse to do that, then escalate it to further by calling 911. So I think some businesses have pretty strong approach to people who are refusing to wear masks in their establishment, because they frankly understand the risk that it puts their employees at, as well as further their customers. But I think I was pretty comfortable with the approach. These people are business people. They know how to handle the situation. I think what folks are seeing is that this is just new to everybody, and it's maybe challenging for some people to address it. But I know that I will continue to encourage that on these calls, and encourage folks to be a bit more focused on their approach with people not wearing masks.
Thank you, Rob. Thank you, Chief. Lauren, do we have another question?
What are the thoughts and everyone's comfort on how quickly the town in 395 has gotten bombarded with visitors? Do you feel that we are properly prepared, even with the regulations in place?
Chief, I'm going to ask you to address that one.
Certainly. Thank you, Brian. It's a great question. This general strategy that we've taken, and we don't have Dr. Boo with us, but certainly Dr. Burrows can fill in and catch anything I may miss here. But as we've said just about every week, there's always more information coming out about it. We know a heck of a lot about this virus, more about it now than we did when we got started. But one of the things we're sure of is that as we're reopening business, which you look at it from another lens, is the reintroduction of high levels of social interaction, which is really what we're doing, then it's like any other time when you're trying to see what cause and effect is. And so when we make a change in mobility, then you kind of need to watch for a while and see what happens. So our first changes in mobility, and we've been tracking that in two ways. One is the state mobility data that looks at cellular and some other tools. And then the other one is Caltrans Region 9. Greg Miller and his staff have been great to work with. They'll shoot me a report on a regular basis that shows traffic on the major highways in the region. And Memorial Day, obviously we had a big spike. And so it was one of the reasons that we were holding off, even delayed Mammoth Lakes a little further than the unincorporated areas to get us a good month, at least 3 weeks between those. So I feel like we've prepared all we can do to prepare. I don't think there's too many more things to do there. The reason I said earlier, pay close attention through July in my opening comments is about 82-ish, I think, % of all the lodging capacity for Mono County is in the town of Mammoth Lakes. So we opened up unincorporated first and town of Mammoth Lakes. And if anybody's been out and about in town, you know exactly what's going on. And so we really need a solid 3 to 4 weeks now to watch. As I said, we've got to have our public health machine out there doing large volumes of testing, looking at what the matrix and the trends are. Hopefully that's our farthest reaching radar. Dr. Burrows and his team are we keep in touch with them on what's going on. The level of activity in the hospital, I'm sure Dr. Burrows will catch it later, has gone up just because we have more people. But we'll look at the hospitalization sides there. So I don't think there's much more we can do in the way of preparation. You've all been outstanding in helping us get there. We knew that it would come in droves. It has. We're getting exactly what we asked for in a tourism economy. They're here. And so now we're just going to point our feet downstream and hope we prepared well enough and try to influence visitor behavior. Dr. Burrows, is there anything you want to add in there? Or Dr. Boo?
Yeah, I can add just a couple things. So one, we asked everybody to stay away and distance and do all of the crazy, ridiculous things we asked them to do for the better part of 3 months so we could get ready. And then we told everyone that we're ready. So like it or not, we're ready. And we're hoping that we're not going to see a major spike or a surge. But we have repeatedly told anyone that wants to listen that we can handle a much higher capacity than we normally would based on all the preparation we've done. I would also remind everybody that I think literally to every state that's opened, they have been very lax on distancing and masking. And every one of those states, for the most part, and maybe there's an exception, have seen an increase in cases. I know for a fact, just recently, the state of Nevada now put an order in place for masking in public, and they did not have that at first. And I don't want to say they're paying the price for it, but they're certainly seeing the consequence of that. The cases are going up, and it's not just people that are testing positive; it's people that are sick and being diagnosed, and hospitalizations and intensive care use needs are going up. And I think what you're seeing in Mammoth, certainly what I'm seeing in Mammoth, is we are way more compliant with the idea of masking and distancing, and certainly in public, than many, many other places, certainly in Southern California and other states. And hopefully, to our credit, that's going to allow us to continue to be open and functioning and maybe see some increase in cases, but not to be so devastating that it completely creates a health disaster for us. So this is the part that Chief Freevault was talking about, and I can only say it till I'm blue in the face. Keep wearing a mask in public, keep washing your hands, keep distancing. Things are open, and that's terrific, and this is just our new normal for a while. And as long as we all behave and play nice, we'll get to have everything stay open. And as I've been telling anyone that wants to listen, that'll allow us to have as close to a normal of summer as we want to have.
Thank you, Dr. Burrows. Thank you, Chief. I also want to say welcome to Dr. Boo, who just recently joined the call from, well, he was on another call. Lauren, what's our next question?
Can you clarify the Tioga Road policy? Are Mammoth residents allowed to drive through?
Chief, do you have information on that?
I can
Yeah.
do that one if you want, Chief.
Okay,
Yeah.
thank you,
Right.
Stu.
Yeah, give Chief a quick
Give him
break
a break.
there. Yeah, so we included that information on the presentation. Again, if you missed it, we'll have that information on the portal tomorrow. You can watch the presentation on the YouTube channel that we have as well through our social media. Yes, you're able to pass through Tioga, east through west. You must show your California driver's license, but your visit must be non-recreational in nature. So, if you're traveling for business, seeing family, through to the Bay Area and back and forth, absolutely, yes, you're permitted to do so. But please be prepared to show your California driver's license.
And
Thank you.
Stu, if I can add to that,
There you go. Thanks, Alicia.
it needs to show Mammoth Lake's address or June Lake, Bishop, or Lee Vining. Thanks.
All right, thank you both. Lauren, do we have another question?
If a business has to close due to an infection, will the public be notified?
Dr. Boo, can you field that question?
Well, there have been a number of businesses that have had to close for that reason in the last few months. And I don't think in any case we've felt it necessary to notify the public. If we thought that there was a significant risk to the public, we couldn't, a lot of people have been exposed and we couldn't identify those people, we might do that, but it's going to be a case-by-case thing.
Thank you, Dr. Boo. Good to see you. Welcome. Lauren, can we field our next question, please?
What is the fire and law enforcement patrol plan for the 4th of July now that Bridgeport is doing fireworks, but Crowley is not? I anticipate there will be a lot of illegal fireworks in Crowley.
Chief, I know fires are your specialty, so here you go.
Each of the fire districts obviously are autonomous. There are 10 plus the Mountain Warfare Training Center. So each of those fire districts approach 4th of July holidays in different ways. Some of them are very quiet. People go to some of the other events. So in general, I don't know that any of them will have anything that's remarkably different than they would normally do with all the other 4th of Julys they've handled. One thing that we are all watching, though, has been this behavior the last, I don't know, week to 10 days of just a lot of spontaneous fireworks going off everywhere in the state. We're not really sure if it's sort of a mini celebration because we're making progress, or if people were afraid there wasn't, that fireworks weren't going to be allowed. The governor recently addressed that. So my one concern is that normally if I've got illegal firework use related fires, they usually don't happen on the 4th. They happen on the 3rd. People get ahead of themselves, or they happen on the 5th because people forgot to burn some off and decide to go out and do it the next day. So what I am concerned about, obviously we've had lightning today, fairly good moisture. We're going to have a red flag, looks like red flag conditions Sunday through Monday. We'll dry out fuels. So probably the only unique things that each of the fire district chiefs will do, I know I will, is we'll work with our federal partners and what their staffing levels are. We'll watch these fuels. And we kind of know the regular places that people will go if they decide to do silly things of this nature, but we can't control everybody, right? We just can't. And honestly, you don't want us to. So we'll be out there, we'll be available, we'll put out what we can and chase the rest.
Thank you very much, Chief. Lauren, do we have a live caller?
We have one.
All right.
Linda Fuller, go ahead and unmute yourself.
Hi, Linda, can you hear us? Linda?
We have one more caller. I can
Okay.
come back to Linda here. Greg Vane, go ahead.
Hi, Greg.
Hi, guys. Can you hear me?
Absolutely. Go ahead.
Okay, I've missed the last couple of these due to work-related conflicts, webinars. But I've noticed that you have a large capacity for testing now, and there seems to be a lot of encouragement for people to test. I personally think my risk of having been infected is so small that it's almost zero. Are you guys encouraging all of us, including people like me, to get tested in order to try to establish, a baseline of what the whole community is like before we start getting visited by lots of folks? What's the policy?
That is exactly the strategy, yes. We definitely need to surveil the community to know exactly what's going on now and monitor that as we move into reopening more and more of our facilities. All right, do we have another question?
Next question. We have some more writing questions.
Okay.
I was told by a contact tracer for San Diego County that several entire families tested positive for COVID after visiting Mammoth and frequenting Mammoth restaurants. Is there an inter-county communication on this?
Yes, actually there is. If there are cases that are related to another county, the contact tracers do investigate and they notify the other counties.
But Brian, I don't think we're aware of any such exposures between Mammoth Lakes or Mono County and San Diego County with whole families being infected, are we?
Not that I am aware of, no. But if they can substantiate that it was contracted here, they would reach out to us.
Great, thank you.
Sure.
I was tested on Monday at the pop-up clinic and I have not received my results. How long do I have to wait?
I can certainly field that one. So our tests, once we're done, get on a plane and go to Richmond, California. They go overnight. So they get them the next day. It's been 2 days that they have them. I've actually just started receiving those results this evening. So after our meeting, I will be reviewing those results and pushing them forward to our team, who will start the notification process. Do we have another question?
There seems to be visitors who are under the impression that because they are here in the mountains, they are safe and they do not need to wear a mask or be careful with washing/sanitizing their hands. Is there a way we can educate the visitors on how critical it is to do these things?
Let's see, who would like to field that question?
I can do that, Brian.
All right, thank you, Stu.
Yeah, great question. Really appreciate the opportunity to kind of speak a little bit about the Stay Safe to Stay Open campaign. Really the goal there is, as the question was framed, to educate not only our locals but our visitors entering Mono County if they haven't been here for a while, they're returning after wintertime. What is the right thing to do? What is the cool thing to do? How should they act? What are the expectations they should be prepared for, traveling in and around Mono County, interacting with our businesses and employees and so forth. So really the goal with this campaign is to make sure everybody wears their face cover. We have signs at each and every one of our businesses. We'll have these notice board signs throughout key locations throughout the county. Again, just reminding everybody to, wear your face cover. If you can't maintain a distance of 6 feet, you're required to put your face cover on. If you're inside these public spaces, and public spaces are anything that is a contained area, that you want to make sure you have your face cover on. And it's really out of self-respect. It's respecting the person, it's respecting you, it's respecting families, it's respecting each and every other person. So it's really that shared responsibility that we're looking for throughout Mono County. That's kind of the Mono County way. So again, look for Stay Safe to Stay Open throughout town, social media, and hopefully that answered the question. I don't know if anybody else wanted to jump in, Brian.
Thank you, Stu.
Welcome.
Anyone else like to add to that? All right, well, just as a reminder, we have about 15 minutes left in our meeting. So Lauren, let's go to our next question, please.
Is there any more information on antibody testing?
Dr. Burrows, would you like to field that question?
At this point, and Dr. Burrows certainly can contribute to this if you want, we are still not certain how we're going to use antibody testing. And that is not to say we're not going to use antibody testing, because we absolutely are. But as far as a set date of who we're going to test and when we're going to test and what we're looking for, I don't have those answers for you yet. A lot of tests became available on the market, frankly, because there was a high demand, and a bunch of companies, private sector and otherwise, came up with antibody tests. Some of them have already been pulled from the market. Really, to date anyway, none of them have had the rigorous testing or validation of those tests to say that they work absolutely the way we want them to. It's not to say they don't, it's just that everything was fast-tracked to get them out and available. At some point, and I'm going to hedge anyway and say by this fall, we're going to have some sort of a process in place where there's clearly going to be people that we're going to want to test for antibodies, probably in some ways to establish, kind of like what we're doing with pop-up testing, how prevalent this condition is, or the virus is, through our community, how many people have seen it and developed antibodies. And I don't want to go too much into the science part of this, but there's antibodies that represent a new infection, and there's antibodies that represent an established infection. And that's going to be important to know also, as far as trying to identify who is newly sick or affected with something that's causing their problems right now, and who has been exposed so long ago at this point that, number one, they're not contagious, and number two, they don't have symptoms. So I wish I could give you a more specific answer right now. I can tell you that we're working on that timeline, but I don't have it yet.
Thank you, Dr. Burrows. Dr. Booth, did you want to add to the conversation?
I don't have too much to add. Thank you. But yeah, I think the role of antibody testing, especially in the public health realm, is just, it's very muddy, very uncertain right now. I'm not sure that it would help us very much to be doing that on a wide scale. You know, I mean, when I'm practicing at Northern Inyo, you know, and I have a patient who's, you know, has a pretty decent story for maybe of having had a case of COVID in March or something like that, I can order antibody testing, and I've done that a few times, not had any positives. But one of the most important things, unknowns, is that we just don't know whether the presence of an antibody in your blood to COVID-19 means anything as far as protection. We still don't have the answer to that. And so, you know, I think around the world, a lot of countries are kind of, you know, having some second thoughts about getting too excited about the idea of, you know, antibody passports and things like that.
Thank you, Dr. Boo.
And just one more thing, Brian. The other thing about it is, at least right now, when we do in places that have done widespread testing, you know, the results of people that test positive has been so disappointingly low. It's hard to get excited about testing a huge population only to have a handful of people test positive. And again, that would, in my mind anyway, change significantly if you knew you were going to get a lot more results that people are now showing they do have antibodies. But to test 100 people to get 1 or 2 people that's positive is not really helpful. It basically represents the fact that really your population just doesn't have antibodies right now.
Thank you, Dr. Burrows. Lauren, can we please have our next question?
Is it possible to add a location category on the portal for positive tests for out-of-towners/tourists?
Can you repeat the question?
Yes. Is it possible to add a category on the portal for positive test results for out-of-towners/tourists?
So for people who test here or test out of county but have visited here, that would be a very difficult metric to track. So I don't think that would be possible. Dr. Boo, what are your thoughts?
Yeah, I'm going to assume that the questioner is interested in people who maybe show up to one of our pop-up testing sites. But otherwise, you know, the way the system works is labs report positive results to the county of residence. You know, where somebody's from San Diego and they you know, turn out to be positive for COVID-19 in San Diego, when they're in LA, it gets reported to you know, as a San Diego case under most circumstances. That's not always true, but yeah, we haven't had anybody who just, you know, happened by the pop-up testing or whatever, or, you know, went to the project baseline testing and was from out of town and got tested positive. If we did, yeah, we could consider putting that on the website. Not entirely sure how helpful that would be, but no reason why we couldn't.
Thank you, Dr. Boo. Can we have our next question, Lauren?
Are TOT rentals required to provide masks for the renters?
Would Dan or Rob like to field that question?
I'd say no.
Yeah, no, we're not requiring that at this point. If there's a lodging property that would like masks, we could be able to assist them with it, but it's not a requirement.
Thank you, Dan. Lauren, do we have any more questions in our queue?
Oh, we have one more question. Remember, I do not write these. Why would businesses be excluded from the grants if they had to close due to the regulations?
Okay, who would like to field that question?
The business grant component, if they had to close due to the regulatory structure of COVID, those are actually the businesses we're working to help. The question would be is if they were closed prior to the COVID pandemic for some other reason, if they were shut down for a violation or some other reason not related to the COVID pandemic, those businesses then may not be eligible for the business grant program.
Thank you, Dan.
I'd like to add to that a little bit too. The intent of the program is to help these businesses stand back up. So I think that the question is if someone's closing down to remain closed, then we really want to help the people remain open so that we don't have, you know, a bunch of closed businesses in town. So I think the key thing is, and Dan's exactly right, if folks who were closing down, but prior to the pandemic, that's a different animal. But really trying to help people emerge out of this with some kind of assistance and grant. So it's really folks that intend to open, then they qualify on that.
Thank you, Rob. Lauren, do we have any more questions?
We do not.
No one live on the line?
No one with their hand raised at this time.
Okay. Would any of my panelists like to address the crowd? All right. Well, since we don't see, oh wait, I see a couple questions came in, Lauren.
If asymptomatic testing is encouraged to benefit the community, how often would you recommend testing after a negative test result? What would be the benefit?
Dr. Boo, can you field that for me?
Okay, thinking back to Greg Vane's question a few minutes ago, which you ably answered, I think that if somebody is really diligently and effectively staying home and not interacting with a lot of other people, the benefit in testing is going to be less. But I think people who are, working, out there in the world, trying to, follow the rules, but, inevitably having some risk, I think getting tested on a regular basis makes sense. And we're trying to encourage that right now among our first responders. And we'd like to be doing some regular serial ongoing testing in the schools, teachers and kids, if we can get that worked out when the schools reopen. Exactly how often, not sure. I mean, it's going to depend somewhat on the availability of testing resources. I mean, I think there's nothing wrong with doing it, couple times a month, but I don't know if, if we'll be able to sustain that.
Thank you, Dr. Boo. Lauren, it looks like we still have one question in the queue.
It's actually just a comment saying thank you. Great to finally be open. Time to go golf, hike, fish, and enjoy Mammoth. Stay safe and stay healthy, everyone.
Thank you so much for that comment. So if there are no more questions and no one else has any comments, I guess this is goodbye for now. So take care of yourselves and each other. Good night, Mammoth and Mono County. Sorry.
Take care.
Right, Mono County.